So, to that extent, that process, that, hope, inducing hope, maybe ketamine is acting through whatever that process. Maybe psychedelics are acting through process. Maybe they're enhancing it. One of the most intriguing findings in reanalyzing this data is that we looked at patients who were on chronic opioids. Like these are patients like who come in for surgery. Sometimes you're on opioids for pain. And one of the predictions we would have is that we know that the placebo system is involved with opioid receptors are involved. And when you're on opioids, oftentimes you develop a tolerance to opioid medication.
Hmm.
That could manifest also as an impaired placebo response, right? And when we looked at the data, again, this is very exploratory, but what we saw is that patients in the placebo group, the ones who were on opioids before they got to surgery, like usually for a couple months, they actually had like no placebo effect, very little placebo effect. Whereas the ones who were not on opioids, they had a big placebo
Hmm.
effect.
And that would imply that, if you're on opioids, you've got tolerance, the receptors have been internalized, there's fewer of them. And if the placebo effect is acting through those receptors, then that's exactly what you'd expect to see.
So an intriguing, there's something in it all, it's like it's been in front of us this whole time about ketamine. What does ketamine do? Long before we started getting excited about ketamine for depression, we were using it as an opioid sparing analgesic. We were using it to reset opioid receptor sensitivity.